muscles. They have parallel fibers in a parallel arrangement. Okay, as we can see on this model of the human torso, right, they're all parallel arrangement fibers. They're wide, thin, flat muscles, so they end in wide, thin, flat tendons, which remember we call aponeuroses, right? So the abdomen is covered with these thin muscles and the aponeuroses of the muscles, right? There's also, of course, going to be layers of fascia. Layers of fascia on here. So we'll get some of this fascia off so we can see the muscles more clearly. All right, so pull this fascia off. All right, notice the segmental nature of the blood vessels there. See that? The body is, the arrangement of body in this region is very segmental. It's almost like a caterpillar. Okay, so we can see a big flat muscle here, and it's coming from way up here, okay, along the ribs. Yeah. That's some tight fascia. I want that tight on the one earlier. I want to damage the latissimus dorsi there. All right, so it's coming from up around the ribs here. You can kind of see where it ends. You can kind of see where it ends right there, sort of in a cup shape, right? Sort of like here on this model, where it ends in the ribs like that, right? And then it goes down in this angle, and if I spread it out, you can see the fibers going down like this, and it's headed over down towards the pelvis. Okay, I tore its aponeurosis a little bit right there, so pretend that hole's not there. It's headed down towards the pelvis. It also spreads towards the midline, so it's going down at an angle, so it's headed down towards the pelvis and towards the midline. You can see where the midline is. In most animals like this, it's not quite as clear on this cat, but there is basically a line going down through here, a white line in the middle. It's called the linea alba, or white line. Okay, here it is on the human. Okay, so this muscle we're talking about here that proceeds from the lateral side on the outside is the most superficial of these, and it comes down at an angle, and it terminates, the belly of the muscle, the fibers terminate at the edge of this muscle, the erectus abdominis. Okay, but its aponeurosis continues over the top of the erectus abdominis and ends at that linea alba. Now that's not a bone, that's just a common insertion point. Okay, so if both muscles from both pull on that linea alba, it tightens the anterior of the chest, it compresses, anterior of the abdomen, it compresses the abdomen. Okay, but also it's going to go from ribs, and it's going down here, we see this is the iliac crest, so it's going down to the pelvis at an angle. So if we think about what bones does it move, well, we think, okay, it's going from ribs to pelvis. So what movable joint is between the ribs and the pelvis? Yeah, right, the vertebrae, right? So it's pulling from the front of the vertebral column between the ribs and the pelvis. What's it going to move? We'll do pulling from the front. You doing it there?
Yes.
What do we call that?
Bang.
Genuflecting, right? Now it's flexion of the torso, right? Okay. Now, so it flexes the torso. It's pulling from lateral to medial. So in addition to flexing the torso, it's going to rotate the torso by you can think of it trying to pull the lateral around towards the medial. So it's going to rotate it like that. Okay? This is the external oblique. It flexes the torso, it compresses the abdomen, and it rotates the torso towards the opposite side the muscle is on. Right? Rotates it that way if it's this muscle, and the other way if it's that muscle. Okay? So external oblique. Now in the human, as you can see, the external oblique goes all the way to the edge of the rectus abdominis. We can't see any of the other muscles under it. Right? The same way in the cat. We can't see any other muscles under here unless we somehow get the rectus abdominis out of the way. So that's what I'm going to do now. Fortunately, I've already made a hole here. So I'm just going to take these scissors and cut along that way. I'll use my scalpel instead. A little more accurate. usually what I do is stick my glove under there and see, okay, I don't see any muscle fibers. That's just, well, it's not fat, it's just fascia, okay? So I know I can cut that. Some people are disturbed by the sound of that. But it's just collagen fibers. Like cutting leather. Okay, so there's that external oblique. Separate it well from there. Let me cut it here. Okay, so now we can fold it back. Look underneath. There's a little bit of deep fascia. Okay, there's the edge of the equinosis of the external oblique where I cut it. The other side of that cut. All right. So now I can see another muscle under here, and its fibers are coming up like this. Right? And they're ending right there. See the edge where the color changes? Okay. And then we go over here. Now, this is the internal oblique. Now, the human, so on this side of the model, the external oblique has been removed, and we can see the internal oblique. Now, the human, I know you can't see that. The human, the internal oblique comes all the way up. Just hold it up. Comes all the way up to the rectus abdominis, right? And then its aponeurosis goes, I think, behind the rectus abdominis, to form part of the sheath that we see here that the rectus abdominis goes through, right? In the cat, though, the internal oblique doesn't go all the way to the rectus abdominis; it stops. Okay, so that's what we're seeing here. This line where the internal oblique stops. Now, there's still another muscle there. That's the third muscle layer, the transversus abdominis. Can't see it real clearly because it's got a fascia over it. But if I try and peel some of that fascia away, just a little bit. Sometimes I'm able to actually separate the internal oblique. Okay, you can actually see there's actually two different sets of fibers there. There's the internal oblique fibers, and there's the transversus abdominis fibers. Those are two different layers of muscle. I know they look similar, but they're not. Okay? Now, I've been talking about the rectus abdominis this whole time. It's over here. Get it separated out. It's not nearly as distinct on cats as it is on people. It's much more distinct on. I think sometimes if I go all the way up to the top, I can get a good edge on it. Not even to it yet.
Random question. Where did you get these cats from? Were they donated?
They are from Bio Corporation, where science, biology begins. It says on the bottom. I imagine they come from pounds and stuff. Okay. I'm not getting a good view of the rectus abdominis here.
What my eyes on
Let's see if I can.
What if you leave?
What'd you say?
Walmart got them too. You can trip.
Some of about to get the head knocked in. Is it?
On the screen, they say public too.
Wow, that's so.
This
This is this cat's a lean machine. Can somebody, I'll get one. Hold on.
I like King of his turn.
This blade's dull.
I can't take you serious with this mask.
Hey, better than that. I'm guessing it's.
These blades, you just stare at them wrong and get dull.
I'm watching the game. Can't see much.
It's usually somebody gets a good angle. Okay. Last thing I need to do is a trip to the hospital.
Yeah, I don't need you.
Most serious accidents we've ever had in the American class. Cutting people. Exploding beakers and stuff, just ripping people apart. You usually have to explain that to somebody. Alright, yeah. So now it looks like the fibers are going this way, but these are just strands of the aponeurosis, right? Those little feathery looking things. The fibers are actually going this way on this muscle. Okay? And then underneath it is the transverse abdominis still. I know that's a little hard to see. So the rectus abdominis does go down along the line. Just in this cat, it is very thin. I just pulled it away a little bit. Okay? So there's your rectus abdominis going down the line there, your transversus abdominis, and your internal oblique. There's three different muscles here. You just have to come and take a look. See, there, there, and there. There's three different muscles. Okay? Here's the rectus abdominis on the human. Now, internal oblique, it's going to basically do the same thing as the external oblique, except it's pulling this way. So when it rotates, it will rotate towards the same side. Okay, so it'll flex the torso, compress the abdomen, and rotate the torso towards the same side the muscle is on. Rectus abdominis comes, rectus means along the line up, so it goes right down the line here, and so between the ribs and the pelvis, so it will only flex the torso and compress the abdomen. It can't rotate. It doesn't have any leverage to rotate. Now the third layer, that transverse abdominis, you can't see on this model unless you turn it over. It's the deepest layer. You can see it goes straight across the abdomen. I always think of it like a cummerbund in an old-fashioned tuxedo, like the one I wore at my high school prom. Just how old I am, okay? And it was the same color as my girlfriend's dress, too, which was fuchsia. And I weighed about 90 pounds, so I look like a fuchsia-colored stick. Right? So there's it's going straight across, like a cummerbund there. So it has no leverage. It goes from fascia on one side to fascia on the other, and inserts into the vertebrae. So it doesn't cross any movable joint. So all it can do is compress the abdomen. Okay? Transversus abdomen. Okay, so this is not the best cat for the abdominals because of this sort of weirdness here. Some of the other ones look a little better. Okay, so let's move on to the lower limb. And this guy is going to be tough. I can already tell that. He does not want to cooperate. You might watch the Walking Dead premiere.
Yes.
That first 10, I was so disturbed by that first 10 minutes. I don't want to spoil it for anybody. I don't know if I'm going to watch it. That was so disturbing. And I've watched it this whole time, and that was the worst thing they've ever shown. Good gosh.
No, it was
was funny. This girl turned in her project and she was like, "Excuse Walking Dead in the background." I'm like, really?
This girl what?
She was like, we had to do like these YouTube projects online for on World Lit, and she was like, "Excuse Walking Dead playing in the background." I was like, "Are you serious? You did your project and listen to that at the same time?"
She didn't want to miss him.
I never seen it.
It's not a good show.
I'm not watching.
Well, you know, it's kind of turning into some. Everything's getting so dark and depressing.
Yeah.
It's kind of like The Road. You ever read The Road, Cormac McCarthy?
Yeah, I read that.
Yeah.
It's from McCarthy.
Yeah, I mean it's a good book, but boy, there's some intense scenes in it. That's sort of what it was like last night.
Yeah. It's too much imagination there.
Okay,
So like the following.
we started to work on the anterior thigh here, and we see this broad flat muscle going from the lateral aspect, crossing over the thigh and inserting into the medial side here. Going into the tibia. Okay, so if I follow it up, I see it's originating in the lateral pelvis. Feels like the anterior superior iliac spine. Of course, it doesn't feel like I just know it. That's what it is. Okay, and then it goes from lateral pelvis. It crosses over the front of the thigh, and it inserts into the tibia on the medial side. Okay, so can someone find me a muscle on that leg that goes from lateral pelvis, crosses the front of the thigh, and inserts the tibia? That's it. Sartorius muscle. You can see it's comparatively much thicker on the cat.
Where is it on the? This right here.
Yeah, sartorius. So it goes from pelvis to tibia. What joints does it cross? What joints are between the pelvis and the tibia? Between the pelvis and the tibia, there are two joints. What are
The
they?
knee joint.
And the hip joint. Yeah.
Okay.
Okay, you guys are making that too hard. I know you do. All right, so let's think about what it's going to do on the hip joint. It's pulling on the hip joint from the front. Pulling on the hip joint from the front, what will you do? What will happen to the hip when you pull on it from the front? You will flex it, right? It's like trying to dribble a soccer ball with your knees. You'll flex it, okay? All right? Now, it's going to go down to the knee, and look, it crosses behind the knee. So it's going to pull from behind the knee. Right? Can you lay that down flat? Yes. It pulls down from behind the knee. So what's it going to do pulling from behind the knee?
Extend the.
Okay, extending the leg is sticking it out straight. If you pull it from behind it, you're going to stick it out straight.
Oh,
Hyper.
It's going to flex it, right? It's going to flex it. Okay, so it's going to flex the knee. It's going to flex the hip. Now, one more thing it does. Now, normally we don't pay attention to rotations of these ball and socket joints unless for the rotator cuff. Any muscle that pulls on a ball and socket joint is going to do some sort of rotation. And I don't ask you to know most of those except for the rotator cuff. But here, I think it's a good one because it pulls from lateral to medial. So it's pulling the medial over to the lateral, so it laterally rotates. Right? So if you flex your hip, flex your knee, and laterally rotate, you're out on the college quad, what are you doing? What are you playing? Yeah, well, you could be playing soccer. Got a little leather bag here. Hacky sack. That's why I call it the hacky sack muscle. It's all the motions for hacky sack. Okay? Sartorius. All right, so let's cut that one right along the midline and reflect it. All right, now there's a muscle here that's not on your list. Can you turn that leg over? Slide it towards me a little bit. Okay, it's a muscle high up here on the hip here that goes into this long fascia that goes down the side and basically compresses the side of the leg. Called the tensor fascia latae. It's not on your list, but you can see this big wide fascia here that it originates from. I just have to get it out of the way. Show you these other muscles, so I just want to point it out. Anyway. Okay, so now I've exposed the deeper muscles of the thigh. I've gotten the sartorius out of the way and that tensor fascial latae out of the way. And I can see three muscles. Here. Let's tease them apart a little bit.
Medial
Okay.
or something.
What's that?
I'm just guessing how they're gonna be called.
These are the quadriceps.
Yeah.
Okay? Three of the quadriceps. Naturally, there'd be four quadriceps, so somebody can hold that leg up straight. Okay? Or flat down so that the top is up.
What is
I'm sorry, so that the front is up, but it's laying down on his back. Yeah, we just support it a little bit. So there's your patellar tendon, right? All four quadriceps insert into that patellar tendon, right? You see here too. These are the vastus muscles, the vastus medialis and the vastus lateralis. Okay, this is the rectus femoris. So we can see those same three on the cat: vastus lateralis, vastus medialis, and rectus femoris. Okay. Come on in a little bit closer. You can find a spot. He's gonna come around there, get behind you maybe.
Can I
You got it?
It's like
Yeah.
dissection projections.
Yeah. I wish I had a better one. Okay, so there's vastus lateralis, vastus medialis, rectus femoris. Now the vastus muscles, they originate in the femur and insert into that patellar tendon. So they're only going to cross the knee. The rectus femoris originates in the pelvis, so it'll cross the hip and the knee. Okay. Now there's one more called the vastus intermedius. It's underneath the rectus femoris. All right, and it also originates. We're not going to look for that. It originates in the femur also. Okay, so the three vastus muscles originate in the femur and certain patellar tendon. The rectus femoris originates in the pelvis. Okay, so because the rectus femoris originates in the pelvis, it crosses the hip joint in the front. So what's it going to do? Crossing hip in the front, it will flex. Okay, so we've got two muscles that can flex the hip in the front here: the sartorius, which I've cut. Notice I cut it in the middle so I can put it back together and see where it went. And then the rectus femoris. The rectus femoris, along with the other three vastus muscles, also cross the knee joint in the front. So what are they going to do? Extend, right? Those are their major extenders of your knee. Okay? All right, so that's the anterior thigh. Let's do medial. Okay, here's a flat muscle on the medial thigh. Thank you, surgical assistants.
Practicing.
Yeah, there you go. Okay, you don't want me as a surgeon. Okay, so there's a flat muscle. It's coming from the pubic symphysis there, right in the middle, and it's coming along the medial aspects of the thigh and inserting into the tibia behind the knee. Can someone find that one that does that? It comes from right on the pubis on the medial side.
Yes, right.
Okay.
So
Right from the pubis down behind the knee. Yep, you got it. That's the gracilis. Okay. Gracilis muscle. Right? So it's pulling from pubis, going from the pubic bone to the tibia. What joints does it cross?
two joints.
The hip and the knee again, right? All right. Let's do the knee first. It's pulling from behind the knee, as you see. So what's it going to do?
Flex.
Flex the knee, right? It's pulling right along the middle from the midline down here. So what's it going to do to the hip? Adduct, right? You can only do one of those because it's pulling from the middle. You can adduct, okay? All right, so that's gracilis. All right, now this is another one we have to cut and reflect because we want to see the muscles that are deep to it. So I'm going to cut right there, reflect it, and I can see some other muscles. Now, there's an issue with comparing human to cat. Several issues, of course, but among them is that humans have round limbs and cats have flat limbs. So it's pretty clear what's medial, posterior, anterior in a human. In a cat, the lateral and the posterior and anterior get compressed into the medial and lateral. That's what I'm trying to say. So this is actually a posterior muscle right here. This one that we can see. This is a medial muscle. This is the adductor longus, right? Which on the human is right there. Okay? And it goes from the pubic bone down to the femur. So it only crosses the hip, right? And it's pulling from right in the center. And its name tells you what it does. It adducts. Now there's a couple other adductors, adductor brevis and the adductor magnus. You may wonder, why do you need all these adductors? Well, remember what I said, if you pull on a ball and socket, it's going to rotate, right? What if you don't want to rotate? Then you have to have two muscles that wrap around the bone in either direction so that both pull from two sides, and then you can adduct without rotating. If you want to rotate, you can just use one, right? So that's why we often have several muscles coming from different angles, inserting into the femur or the humerus that apparently do the same thing because they'll cancel the rotation of each other. Okay? So that is the adductor. We're only asking you to know the adductor longus. All right? Now this muscle across this little gap here is actually one of the hamstrings. This is the semimembranosus, and just in front of it is this other hamstring muscle, semitendinosus. Let me get my finger in there and try to separate that out a little better. Man, this is a tough man.
It's a tough kitty.
No. Okay. Only do it for like 10 or
Did you run out of batteries?
no.
Everybody needs, what we need is GoPro helmets. Like, go extreme, man. Woo, go extreme. Don't go dissect the kid. That's silly. All right. There's your semitendinosus. And then just in front of it, just behind it's your semimembranosus. Okay. These are two of your hamstrings. Semimembranosus, semitendinosus, and then on the lateral side, this big muscle which covers the entire lateral side of the cat's thigh, the biceps femoris. Okay? So slide this side, that's why I hold it right there. These are our hamstrings. The lateral one is the biceps femoris, and then we have two medial ones. The one is superficial, is the semitendinosus, and underneath it, poking out on either side, is the semimembranosus. You will notice that these two lateral or medial ones wrap around the medial side, and then this wraps around the lateral side. They all originate way up there. Thank you. Got a little bit further down. Yeah, all originate right up there. That's the ischial tuberosity. That's what you're sitting on. Okay. So they go from pelvis to tibia. So what joints do they cross? The hip and the knee. So pulling behind the knee, what are they going to do?
Flex.
Flex it. These are your major knee flexors. Okay. And then pulling from the back of the hip, what are they going to do? Extend and hyperextend. Now, what's not on there is the gluteus maximus muscle, which goes from the pelvis down to the greater trochanter of the I think it's greater trochanter. I have to double check that. Of the femur, but anyway, it pulls from behind the femur, and it's the major extender and hyperextender of the femur. Okay, it's a very important muscle in humans. It's one of our major postural muscles, the gluteus maximus. Cats are not upright, so their gluteus maximus is up here, and there's some fascia somewhere. I'm not going to worry about it. Okay. All right, so those are our three hamstrings. Biceps femoris on the lateral side, semitendinosus, and semimembranosus. In a human, the semitendinosus is considered superficial, and the semimembranosus is considered deep to it. And so if you look at the cat, as it were a human, from back here, you see that relationship. All right, so let's move on to leg. Now, before I do the leg, I need to skin out this foot a little bit. So please hold your lunch if you tend to lose it. Some people do not enjoy watching this.
I'm trying to tell you. Tony would be so upset.
Who would?
My cat, Tony.
You probably say, that's one less cat that mess with my food. That's how my cat's attitude would be. She hates it.
Tony's not too fond either. She would actually go to her cage and close her door.
What's that?
She'd go to her cage and close her door.
Oh, really? That's funny. Cute.
It's like I had enough of y'all for today.
All right, so that's probably enough. The other ones were coming off easier, but that's par for the course for this kid. Yeah.
She didn't have 9 lines.
No, didn't just use them all. Okay, that's good enough. No, it's just the skin.
Gloves out of that. That'd be my Christmas present.
Chlorine. All right. Okay, so that's enough. Now we can see all the way down to the top of the toe there. Okay. All right, let me clean up a little bit of fascia here. Okay, so to start the anterior leg, first I identify the tibial crest. And you'll notice most of the musculature is actually lateral to that. Okay? So if we take a probe and stick it down next to the tibial crest, it'll break through some fascia.
Don't do that. You do chicken like that too. Just kidding.
Okay, so there's some fascia I've removed here. Let's trim it. All right, so now I've sort of uncovered these muscles, the anterior leg. This first one here is the tibialis anterior, and then right next to it, underneath apparently additional layer of fascia that not all cats have. Is, yeah,
This cat was an outside cat for sure.
Obviously.
we got a line twice for sinew. Okay, so there's your tibialis anterior. Comes from the tibia. You look here, we can follow its tendon. The tendon goes underneath, it's right next to the tibial crest. Okay? The tendon goes underneath a band of tissue, and you can see those little white bands around the ankle. Yeah, those are called retinacula. Right there, yeah. Retinacula, there's actually 2 of them, and they direct the tendon into the foot. And we see it inserts here on the medial foot, on the medial side of the foot, on the top and medial. So it goes from tibia to the top of the foot. So it's going to cross the ankle, right? Pull it on the top of the ankle. What's it going to do? What do we call that motion?
Flex.
What type of flexion? Dorsiflexion. Very good. Okay, dorsiflexion.